Hello, everyone. Welcome to today's session. My name is Hannah. Today we're going to be talking about a couple of different medical conditions related to fatigue, specifically cancer and COVID-19. Before we get started, this is just very brief overview. It's not going into specifics. We're going to talk about statistics, what we see in Texas and the United States, some risk factors for cancer, prevention, treatment, and how exercise can help, and then also with COVID-19 looking at fatigue, as has this been shown to be a common symptom that we're finding for individuals diagnosed with COVID-19. So let's get started. Okay, so I just talked about this. We're talking about fatigue, look at cancer and COVID-19, and then we'll finish with my references. So what is fatigue? This is kind of an odd feeling. It's you feel overtired and you have overall low energy, which impacts your ability to participate in your daily activities or things that you find meaningful. This can take over physically, mentally, and emotionally, and it just fully drains your body. And fatigue is something that impacts us all individually. So not one person is going to experience fatigue like another person. With that being said, fatigue is a common complaint that we see in individuals in older adulthood. In fact, 50% of older adults are now reporting chronic fatigue, which is going to lead to decreased quality of life. So something to be mindful of, and we're going to talk about some ways to manage our fatigue later on in today's session. So with fatigue, there's a couple of things that can be linked to it. So it can be traced to our lifestyle and our habits and our daily routines. So think about your personal lifestyle, alcohol or drug use. If we're drinking every day, are we using drugs frequently? Are we engaging in too much or too little physical activity? What are your medications? Is fatigue listed as a side effect, as well as sleep? If you're having poor sleep, that can impact our fatigue, and poor nutrition. So that's our lifestyle factors. But now looking at fatigue can also be a symptom of an underlying condition. We talked about heart disease and lung disease a couple weeks back. They were talking about cancer and COVID-19 and how fatigue, again, is a symptom of these conditions. So with that being said, we're going to jump in to cancer. I understand this is a heavy topic and that we all have, or I'm sure most of us have, a loved one, friend or family, neighbor, or someone who has been diagnosed with cancer, and so I know it has probably impacted a lot of us in our lives. So anyways, we're just going to dive in. I know it's heavy, but it's good to have some awareness about cancer. So what is it? This is a condition that occurs due to an abnormal cell growth in our body, and with that being said, this can lead to the potential to spread to other parts of our body. Cancer is something where it's labeled and named based on the body of where it originates from. And with that, there are two different types. We have blood cancers. This is cancer of the blood cells, such as leukemia, lymphoma, and multiple myeloma. And then solid tumor cells or cancers that can impact any other body organs or tissues. Some common cancer diagnoses that we see for females include breast cancer, and for males includes prostate cancer. And here is some statistics that we see in the United States. So in 2018, again, this is from a couple of years ago, so with that being said, there might be even more now, but in 2018, the US reported 1,700,000, and a little higher than that, of new cancer cases, with about 599,000 people actually dying of cancer. Cancer is the second leading cause of death in the United States, with about 1 in 4 deaths in the US are due to cancer itself. In Texas in 2018, we saw about 120,000 diagnoses. So here's just a chart of the top cancers that we see in Texas in 2018, with female breast cancer being the most frequently diagnosed, followed by prostate. As I mentioned earlier, those are very commonly diagnosed for females and males. So next, we have our stages of cancer. So we have stage 1, which is where we would have a small tumor. It could be benign or malignant, and there's not a spread yet to our lymph nodes or other tissues. I take that back. If it's stage 1, it's probably going to be malignant, and has the potential to spread. So it's important to catch it in the early stages, and stage 1 is considered the early stage. Next, we have stage 2, which is localized. So this is where the cancer has now started to affect a nearby tissue. It may have grown in size also, or it could have spread to nearby lymph nodes. Stage 3, a regional spread. Now the cancer is affecting more surrounding tissue, it's continuing to grow, and it may have actually spread to lymph nodes further away from the mass. So it's kind of starting to spread throughout the body. Distant spread, stage 4. Now the cancer itself has spread to other tissues or organs, and this is sometimes called advanced cancer, yeah. So stage 4 cancer. So those are the 4 different stages. Now we have some signs and symptoms of cancer, so some things to be mindful of. Fatigue is one. This is a sign and symptom if you're overall just feeling drowsy and tired. If you experience a sudden weight loss or gain for no apparent reason, if you're experiencing nausea, swelling or lumps in the body that you're starting to, feel, pain for no reason, especially in your joints, and then headaches. Just a couple more. Bleeding or bruising for any unknown reason, eating problems, maybe you're not eating enough or you're eating too much, so your diet has changed, bladder changes, increase in urine frequency or decrease, mouth changes, if you're having sores and bleeding that's not going away in your mouth, that could be a sign or symptom. If you're having consistent cough, and then changes in your bowel habits, so you're having increased constipation or diarrhea for a longer period of time. So a couple of risk factors to think about. What research tells us is that alcohol and cancer, there's a correlation between these two. So what we find is if you have a decreased alcohol consumption, that can decrease your risk of cancer. And alcohol can actually lead to different types of cancers like mouth and throat cancer, our voice box or our larynx, esophagus, colon and rectum, liver and breast cancer. With that being said, this is like heavy alcohol use, and it's not always going to be a direct cause, but for women, they suggest about 1 to 2 drinks of alcohol per night is probably a good max to stay at, and for men, it can be about 3 to 4 drinks per night. So just being mindful of how much alcohol we're consuming, especially over a long period of time. It's also important to think about our family history. So if you have a relative who is diagnosed with cancer before the age of 50, then definitely talk to your doctor about that so that you can get some screening tests done and just stay as on top of it as you can. So looking at breast cancer, ovarian, uterine, and colorectal, these are the 4 different types that we see that are most generally involved with family history and genetics. Okay, next we have obesity and cancer. So obesity, and also in addition to that, tobacco use and alcohol use can lead to an increased risk of developing 13 different types of cancers. So there's quite a few on this list. And again, it's most likely not going to be just obesity, but having those other factors involved too, the tobacco and alcohol. For tobacco and cancer, tobacco can cause cancer really anywhere in the body, and we usually just associate it with being or affecting our lungs, but this isn't really the case because there's quite a number of areas and organs that it can impact as well. Some things to just keep in mind. For cancer prevention, now we're just going to move on to some things to give us a little bit of hope here. So screening tests, these are important. They help us to check our body for cancer before the symptoms arise. Especially we have screening tests for breast cancer, our cervical cancers, lung, prostate, and colorectal. So these are the big screening tests that we can check, be mindful, and just help prevent or find the cancer early. There are also some vaccines. So we have the HPV vaccine that helps to prevent the risk of developing cervical cancer, and then the hepatitis B vaccine, which can help decrease the risk of liver cancer. In addition to that, our lifestyle, so how we take care of ourselves, can also help prevent cancer. So avoiding tobacco use, limiting alcohol consumption, protecting our skin, so wearing sunscreen, and maintaining a healthy weight. So one thing we're going to talk about today is our cancer and fatigue, and experiencing fatigue before, after, during cancer treatment. So I mentioned this earlier, but fatigue does affect the whole person physically, mentally, and emotionally. Fatigue is often recognized as a side effect or a symptom of cancer and the treatment itself, so chemo and radiation. Fatigue can last for months to even years following treatment, and it just depends on the individual. It also depends on what type of cancer they're diagnosed with, what is the phase of the disease, and what treatment was being provided. So a couple of different things that can affect the fatigue. Um, the fatigue is a little interesting because there's not a set standardized assessment or a screening that can measure fatigue level. This is really based on subjective measurements and talking to your doctor, describing if your fatigue on a scale of 0 to 10. 0 is no fatigue, 10 is the worst fatigue imaginable for you. And if you are experiencing constant fatigue and nothing seems to be helping, a couple of questions to be mindful of and keep track of. When did the fatigue first start? How long has it lasted? Does anything make it better or worse? Are there times during the day that you notice the fatigue more or less? And has the fatigue or how has the fatigue impacted your ability to participate in meaningful activities? So is it affecting your ability to complete your chores, go to work, sleep? There's a couple of different things to just think about. With fatigue management, there's a couple of things you can start implementing into your daily routine to help. One being scheduling rest breaks. Include that time for you. Take some time for self-care throughout the day, even just 30 minutes at a time, little power naps. If your medications that you're taking, so fatigue is one of the side effects, then just talk to your doctor about that. Maybe switching over to a different brand or something can help. Engaging in moderate intensity exercise, getting that 150 minutes of exercise per week will help in fatigue management. Delegating tasks to family and friends. If you need help picking up groceries, or if you need help doing things around the house, reach out to someone that you, or reach out to others if you need help. Adequate sleep, that one's kind of tough, but it's a big portion of managing fatigue overall. Plan and prioritize important tasks. Avoiding caffeine, that one's tricky. I know I love my coffee too, but if we rely on caffeine just to give us that little boost of energy, then your fatigue is never really going to go away. Avoiding exercise late in the evening, I put this in there, but it really just every person has their own time and they want to exercise. If in the evening works for you and that's continuing to work, then don't change it up. But if you're noticing that you get fatigued really easily, then I probably would avoid exercise in the evening so that way you can sleep better and feel less fatigued overall. And then lastly, avoiding hot showers in the morning. This can take our energy away when we wake up. And so if you're going to take a hot shower, it's recommended to do that in the evening before you go to sleep. So this is quite a lot on this page, but what are the benefits of exercise that we're seeing? In the past, what was encouraged was for individuals with cancer-related fatigue was just to relax, to not do anything, just to rest. That has since changed, and now research is suggesting that physical exercise is actually helpful in reducing fatigue. So you don't just want to rest and relax and hope that the fatigue goes away. What we're finding is that engaging in aerobic exercise like walking or jogging can help improve your fatigue during and after cancer treatment. In addition to that, during cancer treatment, having aerobic exercise, yes, but also some resistance training, as well as engagement in yoga or some days of relaxation are important to help manage fatigue. And then following cancer treatment, less focus on relaxation overall. Now we can start building in a full workout, getting your strength training, getting your aerobics, your stretching, all very important, working on your balance. So yeah, that's something different. So instead of just focusing on rest, now physical exercise has shown to be really helpful. So what are the benefits of exercise? There's quite a few of them. One, this can help improve our self and our confidence physically and mentally. Can help with our mental health, especially after going through cancer and the treatment of cancer. That can take a toll on us. It helps to reduce fatigue, decrease depression. It helps improve your sleep hygiene. Improves your muscle strength, your range of motion, your brain health, your bone health, all super important. It can help to strengthen your immune system. And it also may help with lymphedema management. So engaging in physical activity is definitely encouraged. And lastly, just improving your quality of life. Definitely, overall, there's a lot of benefits for exercise. So contraindications are things to be mindful of if you are going through cancer treatment or you just finished cancer treatment. Exercise as you are able. Do not push yourself. Again, scheduling those rest breaks is really important for us and our muscles to help us get throughout the day, and don't overdo it, because even if you're feeling really good one day, the next day you might have overdone it and now you can't do anything then. Just be mindful of yourself. Um, Avoid exercise if you are feeling dizzy or unstable. We don't want anybody to pass out or fall, because this can lead to other complications that may affect us and prolong our recovery. Incorporating rest breaks, I said that already, and then avoiding exercising at a moderate level of exertion without talking to your doctor. So start in relatively small steps, keep it light, and then build up gradually. That's definitely important. And then if you have, or you've been informed that you have low bone mineral density, use lighter weights, and remember those joint protection principles, keeping our bones really strong and healthy. Okay, switching gears a little bit. So we just covered a lot of talk on cancer. Now we're going to talk about COVID-19 and fatigue. We're not going to talk about all the statistics and what COVID-19 is. Y'all, we probably hear about that every day, and we have for the past couple of years. So we're going to talk about just fatigue and this symptom alone, because it's something that we're seeing across the board. So fatigue is one of the most common symptoms that is reported by individuals who have been diagnosed with COVID-19. What we're finding is that fatigue typically starts to decrease about 2 to 3 weeks post-diagnosis. However, some people are experiencing fatigue for weeks to months after being diagnosed with COVID-19. So it's just kind of a funky thing. COVID-19 we're still figuring it out. It's kind of a bizarre virus and how it impacts all of us so differently. With that being said, though, there are various factors that contribute to your fatigue level, especially if you do have COVID. So what happens is that we feel fatigued, right? Because our body is internally trying to take care of this virus. So then we don't want to engage in physical activity. And if we don't engage in physical activity, then we're kind of staying in that rest, relaxation, or inactivity. And we don't want to work out. And so then we have more fatigue. So it's just, even if you are feeling fatigued, going for a walk or something outside can help just give us a little boost of energy that we might need. We also may experience a disrupted daily routine. So if we are feeling fatigued due to COVID, then we're less likely to do things that we usually would do on a daily basis, like getting up, making breakfast, doing laundry, cleaning the house, going to work. All of those things can become disrupted, which throws us off and then contributes more to that fatigue. Poor sleep hygiene, low mood, and increased stress. So there's a couple of things that we see that contribute to fatigue. So what can we do about it? Number one, just be kind to yourself and recognize that your fatigue is real. So it's important definitely to schedule rest breaks, but also make some time to find things that you find meaningful if you are experiencing fatigue. Number two, develop a good sleep routine. Getting to bed early, maybe shutting your phone off an hour before you want to go to sleep. Maybe taking that hot shower before you rest, practicing some mindfulness techniques, something like that. Practicing mindfulness, I just mentioned that. And then you can do plan, prioritize, and delegate. So plan, create a schedule for yourself. What do you want to accomplish that day? Prioritize, decide what activities are most important to you and what you would feel successful or what you would find meaningful that day to get done. Lastly, delegate. So seek support from friends and family. Ask them to make some meals for you or pick up something from the grocery store. Keep an activity diary. So if you wake up in the morning and you do dishes and you write down like how you felt after doing dishes. Was it too much or was it just okay? So just being mindful of what activities are pushing you to your limits and what you think you can keep on going. Maintaining an exercise routine, definitely important, and then a nutrient-rich diet. This is tricky because when we feel fatigued, we don't really want to cook or anything like that. We want to just do the easy route, and that probably involves processed or fast foods, and that's just going to make us feel slumpy and not so energized. So a couple of different things that we can do to help with fatigue management. Lastly, there's some research out there now honey's always been very good for us, but now we're finding that honey actually can reduce fatigue, specifically post-exercise. So once you go into the gym or TriFitness and you go home, you may feel fatigued from working out and you don't have energy to do something else. But if you have like a snack with some honey, specifically local honey, this may actually help reduce fatigue. So something that they're noticing, and it's pretty cool because honey is just, it helps with allergies, it can help with feeling fatigue. So something to try out if you're ever feeling fatigued after working out. All right, and here's just a couple of my references from today's talk. If you have any questions or concerns, you know where to find me. Monday through Wednesday, we are here, and I'll have also listed my email if you have any questions. All right, thank you all.